Welcome to this medical education video on the GIT abdomen, compiled by Dr. Navdeep Gaur. Let's review the sacral plexus branches from L4 to S5. Key branches include the nerves to obturator internus, quadratus femoris, and piriformis, as well as the superior gluteal nerve. The inferior gluteal nerve innervates the gluteus maximus. The pudendal nerve covers pelvic floor muscles and sphincters. The sciatic nerve, the largest, divides into tibial and common fibular branches. Abdominal wall innervation involves several nerves. The external oblique and rectus abdominis are supplied by intercostal and subcostal nerves. The cremaster reflex is due to the genital branch of the genitofemoral nerve. The abdomen is divided into 9 regions. The upper row consists of the right hypochondriac, epigastric, and left hypochondriac regions. In the upper regions, the right hypochondriac contains the right liver lobe and gallbladder. The epigastric region includes the stomach and liver. The left hypochondriac holds the spleen and stomach. Moving to the middle row, the right lumbar region houses the ascending colon and right kidney. The umbilical region contains the small intestine and transverse colon. The left lumbar contains the descending colon and left kidney. Finally, the lower regions include the right iliac with the cecum and appendix. The hypogastric region contains the bladder and uterus. The left iliac contains the sigmoid and descending colon. This image provides a visual overview of the 9 abdominal regions and the key organs located within each area, defined by specific anatomical lines. Key horizontal planes include the transpyloric plane at L1, the subcostal plane at L3, and the transtubercular plane at L5. The supracristal plane passes through the L4 disc. Vertical planes are the median, which divides the abdomen into 4 quadrants, and the midclavicular planes, which define the lateral boundaries of the central regions. These are crucial for clinical reference. Important anatomical landmarks include the lumbar triangle of Petit, a common site for hernias. The renal angle is used for kidney tenderness assessment, and Hesselbach's triangle is the region for direct inguinal hernias. Focusing on peritoneal folds, the greater omentum includes the gastrophrenic, gastrosplenic, splenorenal, and gastrocolic ligaments, each associated with specific vessels. Other peritoneal folds include the mesentery, containing superior mesenteric artery branches. The sigmoid mesocolon and transverse mesocolon carry important colic vessels. The lesser omentum houses the portal vein and hepatic artery. Critical hepatobiliary triangles include Calott's triangle, containing the cystic artery and node, bounded by the cystic and common hepatic ducts. Pesaro triangle is where 90% of gastrinomas originate. Reviewing gluteus muscles, the gluteus maximus originates from the ilium, sacrum, and coccyx. The gluteus medius and minimus originate from the ilium outer surface, inserting on the greater trochanter. The abdominal aorta has major branches. Unpaired branches include the celiac trunk, SMA, and IMA. Paired branches include the renal arteries, gonadal arteries, and 4 pairs of lumbar arteries. Gastric mucosa cell types include parietal cells, which secrete HCl and intrinsic factor, and chief cells, which secrete pepsinogen. Mucus cells secrete mucus, and G cells produce gastrin. Vitamin B12 absorption begins with binding to R proteins in the mouth. In the stomach, intrinsic factor is secreted. The complex is absorbed in the terminal ileum, and then binds to transcobalamin 2 in the blood. Gastrin secretion is stimulated by factors like the vagus nerve, peptides, and distension. It is inhibited by secretin, GIP, and acid/somatostatin. Taste receptors include T1R2 and T1R3 for sweet, T1R and T3R for umami, and the T2R family for bitter, which has a protective function. Salty taste involves ENAC channels, detecting sodium ions. This slide relates to the basal electrical rhythm, or BER rates in the GI tract. Gastrointestinal stromal tumors, or GIST, are mesenchymal tumors arising from the interstitial cells of Cajal. They are most common in the stomach, with upper GI bleeding as the chief symptom. Carney's triad involves paraganglioma, pulmonary chondromas, and sporadic GIST. For GIST, CD117/c-KIT is the most common immunohistochemistry marker. DAG1 is the most specific. CECT abdomen is the initial imaging of choice. GIST malignancy is determined by Fletcher's classification. Treatment involves complete surgical resection and imatinib for unresectable or metastatic disease. Metastasis typically spreads hematogenously. In summary, a comprehensive understanding of abdominal anatomy, including regions, planes, and peritoneal contents, is essential for clinical examination, diagnosis, and surgical planning. Thank you for watching this video from the Medical Education. Find more educational modules on anatomy and pathology through the provided link.